Today's conversation takes us to the front lines of public health, from SARS to COVID to global challenges we face today. Technology isn't just about apps and dashboard here. It's about saving lives, scaling resilience, and preparing for the next outbreak we all hope never comes. Karen, welcome to the show, and we are so excited to have you here. When I think of the SARS outbreak, right, in 2003, I think about how unprepared most of the systems were for the speed of the disease which was spreading that moment of time. For many leaders, that was a moment when technology went from nice to have to mission critical in protecting population, because it was that moment of time when you were just saving lives.
Certainly the manual processes around how that data was captured did not scale at all, which we learned hard and quickly. We could have worked much differently if we had been properly supported by digital tools, right?
Yeah.
Like the FoxPro database was not up for it at all. We used spreadsheets and sticky notes and whiteboards and very, very manual tools.
Building public healthcare infrastructure is not like building any customer app, right? It's not that easy. So you were designing repositories that millions of people lives would depend upon, immunization records, prescription drug data, outbreak management, and a lot of other different stuff. And toughest challenge is that moment of time you were designing assets of that scale.
The business staff, the health policy staff were not good at communicating requirements to the IT staff, and the IT staff weren't very good at wrapping their head around the business outcomes that the systems that they're building were aimed to deliver. Complex processes would get oversimplified just so that it could in the BRD.
Fast forward to 2020 when COVID hit. Okay, suddenly public health was under the spotlight. Dashboards became the lifelines for policymakers, vaccine tracking became the national security, and yet the pressure on the teams was really immense. What has worked and what were the lessons learned during that time in the public healthcare?
From a technology perspective, it was I called it pandemic privilege. 18-year-old system, I've been trying to connect it to our provincial lab registry, because we have a lab registry that has all of these lab results. So where there's a notifiable disease would come in for 10 years. We did it in 2.5 weeks.
Wow.
You need something that can react to changing science and the evolving situation at breakneck speed. You need agility. You need scale. You need the ability to go with the pandemic solution. We started off with the first 2 immunization clinics. I think we had 70,000 immunizers using the same system. You can't do that with a legacy approach to technology. This is huge. I think at peak it was like 30,000 doses were provided that day. Like, it was an insane number. The system started to get a little laggy. And they had paper processes. They're ready to go to paper. I'm like, no, not yet. Give me 10 minutes. Took us 8 minutes to get in, change the configuration, and that system was back up and running. Everyone who left that clinic left with a dose and a copy of their digital electronic proof of vaccine certificate in their inbox and all the data in the central repository. So
great.
That kind of scale.
This is what an achievement is, I would say, that saving lives plus keeping in record, right? It's not easy doing that in such pressure and in such short period of time when you have panic all around yourself. So now you are with Salesforce and you're bringing these lessons to governments across the globe, right? And the exciting part is now that healthcare leaders are moving forward. And they're experimenting with AI, automation, digital engagements in the way we couldn't really imagine 15 years ago. They're just closing all the gaps which we have. What are certain things which really excite you right now?
We've been working on at Salesforce is productionizing. I'm calling it for a cyber epidemiologist. And what it's doing is using generative AI and AI algorithms, predictive AI algorithms, to monitor unstructured and structured case data and to suggest potential connections that are being missed.
I get goosebumps when I listen to such stories, and I'm so inspired by the hard work being done by leaders like yourself.